prayers is going to be crucial as you begin your day, even before you read the newspaper, before you listen to Cito Beltran or watch Agenda. I strongly suggest that you start your day with prayers. And I'm not being holier than holy. It just really helps to kind of stay balanced and on point. In any case, today is July 14, Tuesday. Technically, it's supposed to be the day before the President Rodrigo Duterte makes his announcement or his how do you call it, the assessment of whether Metro Manila will be under modified GCQ, etc. But word is the president is going to be speaking this morning, so please don't be surprised if suddenly our program is put on hold so that the president makes the valuable pronouncement. But from the looks of it, anyone who's making a bet, kung kayo po isa bungero at pumaparada kayo sa meron, baka ako doon na ako sa dehado. Kasi from the looks of it, the numbers today are so bad as far as COVID-19 cases are concerned, and we're going to tackle that. We will be discussing the problem of the unusual rise in COVID cases. And we will be interviewing quite a number of really well-known and experts on the subject matter. We will be bringing in former Secretary of Health, Paulyn Ubial, to talk to us from her experience and her perspective. Then we will have a free for all with Dr. Susan Pineda-Mercado, former Special Envoy for Global Health Initiatives with the World Health Organization, and of course our regular Dr. Anthony Leachon, former advisor to the National Task Force Against COVID-19. And today will primarily be about COVID-19 cases because I think a lot of you are still wondering what's going on. That's the problem when most of us are under quarantine. We're dependent on pronouncements, announcements, pressers, and of course, regular programs such as Agenda. And we will find out today, hopefully, what the real score is. For you who may not have picked up on the news, katulad ko, medyo na-pick up, baka hindi nyo alam, may mga bago ng mga SAR. Hindi po pang-asar, mga SAR, as in people in charge for isolation. That is Secretary Mark Villar of DPWH. For contact tracing, Mayor Benji Magalong of Baguio City. And for treatment, yung pong si Undersecretary Vera of the DOH. Now, let's move on to our headlines for the day. Here are the stories from the front page of the Philippine Star. Critical care capacity of hospitals is approaching the danger zone as it breaches the 70% mark, says the Health Department. This after at least 3 hospitals in Metro Manila said their COVID-19 wards are already full, and as such, they would no longer accept COVID-19 patients. These hospitals are St. Luke's Medical Center in Quezon City and at the Bonifacio Global City and Makati Medical Center. This is the second time the 3 hospitals have declared full capacity since late March, a few days after the Enhanced Community Quarantine or ECQ was implemented in Luzon. Aside from this, the National Kidney and Transplant Institute, or NKTI, said their COVID-19 beds have also reached the danger zone. President Rodrigo Duterte is expected to announce new quarantine classifications later today, if not tomorrow. This as we are one day away from July 15th, the supposed deadline of the various quarantine restrictions implemented nationwide. But the palace made it clear that President Duterte has yet to make a decision and that they will study the data to see if they can ease restrictions. To temper expectations, presidential spokesperson Harry Roque said that at least for Metro Manila, the data does not show that quarantine measures can be relaxed. For National Policy on COVID-19, Chief Implementer Carlito Galvez Jr. said that restrictions might even be tightened in some areas. While we wait for the president's decision, the Trade Department announced that they are giving a go signal to increase the capacity of dine-in restaurants. Trade Secretary Ramon Lopez said they are set to release this week a memo that will allow increasing the operational capacity of dine-in establishments. In general community quarantine or GCQ areas, capacity will be increased to 50% from the previous 30%. While under the modified GCQ, the least stringent of quarantine measures, restaurants will be allowed to operate at 75% from the current 50%. These new rules will take place on the 21st of July. And finally, the National Task Force Against COVID-19 announced that it has approved at least 2 passenger barrier designs for couples riding motorcycles in tandem. The 2 approved designs are made by motorcycle service provider Angkas and Bohol Governor Arthur Yap. Now, authorities are urging the motorcycle riding public to use said prototypes. And those were the primary stories on the front page of the Philippine Star. And we now go to our interview. Our first guest is a former secretary of the Department of Health. She had a short stint as regional director of DOH Davao Region. Let's welcome former Secretary Paulyn Ubial. Good morning, ma'am.
Good morning, everyone, and good morning, Cito.
Yeah, thank you for joining us and it's nice to catch up. Alam mo, paano na ba tawag siya? Doktora, I suppose.
Doktora, yes.
Doktora, nasaan ka ba ngayon, Doc Pao? Nasa Manila ka ba o sa Davao? Because hindi ba tiga Davao ka?
Yes, I was in Davao for some time. We have a farm in North Cotabato.
Mhm.
But after the ECQ, I was actually on my way to Antique, but I was where my husband is, but I was trapped in Manila. So I'm in
Ah,
Manila.
okay. So isa ka pa doon sa mga ano ba
Locally
yun?
stranded.
Locally stranded.
I was on
Pati
my way to Antique.
Okay. Well, I mean, I respect you for that because hindi mo ginagamit yung pagka-former secretary or mga koneksyon, etc. Hindi katulad na iba na medyo namamasyal na kung saan-saan napupunta at ginagamit yung mga travel passes. Ano? In any case, talking about so you're stranded here. Nabanggit mo kanina when we were doing the audio test that you were actually on your way out to go to the Quezon Institute or QI.
Yes.
Teka, hindi paano nangyari yon kung dapat papunta kang Antique and then bakit nasa QI ka? Hindi ba sarado na yung QI na yan?
Yes. Actually, a few days after the ECQ announcement, a friend of mine in the Department of Health asked me if I can volunteer for the Quezon Institute, which will be opened as a mild COVID isolation facility.
Mm.
March 20 yon. So we had a planning session with Philippine Tuberculosis Society, who actually is the owner of QI. and a few other doctors and nurses who were also volunteers like me. And on April 6, we opened the Quezon Institute as a mild COVID isolation facility.
Uh,
We currently have 112 beds and it's near full capacity now.
Okay, now, Secretary, Doktora, hindi ka pa ba nadadala na pagsisilbi sa gobyerno? I mean, I'm being very honest and being, upfront because, you didn't have a very pleasant stay as secretary. You were attacked by so many people. People fought with you. Maraming mga vested interests, etc. And one would think, ay, bahala ka mo diha. Mauli na ako, 'di ba? Parang
Mauli. Opo.
mauli na lang, 'di ba? Pero you still volunteered and magvo-volunteer ka.
Yes.
Frontline 'yan, doktora. I
Opo.
mean, pumayag asawa mo?
Opo. Despite his objection. uh, and my family's objection. Pero
Mhm.
I know my family knows me na hindi naman ho ako pwedeng umupo lang sa bahay if
Mhm.
there's something happening. And despite my sad experience in government,
Yeah.
talagang I felt that it was something that I can do and I can help with, so I volunteered.
Okay. Now, I have to commend you for that because not only did you have an unpleasant stay at the DOH, the fact that you are a former secretary and you are volunteering now, you are now status of a volunteer there. Medyo ano yan, sobrang pagpakumbaba yan, that you're swallowing a lot of pride, if not stature, in doing that.
Uh, I don't think so because that's the call of the times. In fact, when I was health secretary, when people was asking me after my stint, what will you do now? I told them, I'll go volunteer as doctors to the barrios because that's where I started in my career as a public health official.
Mhm. Okay, well, as I said, I commend you for that. Malaking bagay ho yun. Napakarangal ng ginagawa ninyo and it's very exemplary. Now, going back to why we actually invited you, because you've had the experience working in the trenches, working inside the Department of Health, and then now you are in the front line. Ano pong masasabi nyo tungkol dito sa situation natin? Kasi parang back to zero na naman tayo or parang tayo nag-reset back to the starting line dahil March, tatlong hospital nagsara, fully loaded na sila. Now it's the same thing again. What is your assessment? What seems to be the problem?
Actually, when we started in March under enhanced community quarantine, that was we knew that that was just a respite because we were buying time so that our health system can be improved, the beds can be allocated for seriously ill COVID. So that period of about 2 months was just shall we say, preparatory period. We
Mm.
know that something worse is yet to come because this virus is not going to go away. So that was the time that we prepared the system. We have more than 3,000 beds, including QI, that is for mild COVID. So that will free up our hospitals. And the hospitals, we identified PGH, the Lung Center, and the
Mm.
Jose and Rodriguez or TALA as our COVID referral hospital. So, naayos natin yung ganong referral system.
Mm.
Otherwise, if we were not able to do that, we'll be in a worse off situation right now.
Okay, so so yung goal at that time was to buy time, and we did. We succeeded. We learned, at least you doctors all learned how to deal with this COVID-19
Yes.
better, and we've started to really save lives kasi mas konti ang namamatay in comparison to other countries. So meron tayong na-achieve na knowledge and management skills. Pero what do we do now? Kasi parang confused na ang tao, secretary, confused na, doktora, confused na kasi parang ano ba talaga, marami bang kaso kasi marami nang natetest o talagang maraming kaso? Because I was startled by what the DOH announced recently. They can no longer identify a specific point of origin for contamination or contracting the disease. Ang nangyayari parang lahat na raw kung saan-saan na nanggagaling itong infection.
Well, based on our experience, the time we had 2 months in ECQ, I think we gained a lot of experience. Like sa amin sa QI, based on our
Mhm.
experience, meron po kaming mga protocols na pinapatupad. And we are very strict about social distancing, about wearing mask, about hand hygiene and cup hygiene with our patients and with our staff. So nakita ko po kahit na may nag-positive po sa staff namin,
Mhm.
it was a utility at first, then nagkaroon kami ng isang nurse, isa lang or dalawa at a time na
Yeah.
nagka-positive, not the whole staff. So I learned that really it's the practices of wearing masks, social distancing, not eating together, no touch policy, hand washing all the time, or hand hygiene that really kept us free from COVID. So
Mhm.
even if our staff, they come from the community, pagpasok nila, siguro sa community nila nakuha because we have not established that they got it from the patients in QI. So
Okay.
yun yung nakita namin. If we really practice discipline, social distancing, wearing mask, hand hygiene, hindi po kakalat ang COVID. Oh, the problem I think right now in the community is medyo 3 months na tayo or 4 months, medyo nagiging lax na yung mga tao. Akala nila na wala na yung virus, pwede nang maglakad
Okay.
ng walang mask.
Sec, I have to apologize, no? Kailangan kong putulin yung interview at yung programa kasi magsasalita na raw po si Presidente Duterte. Pero babalikan po namin kayo at a more convenient time, and let's continue talk about your work at the
Yes.
QI, etc. Thank you very much, and I really apologize for this inconvenience, Secretary. I
No,
really
it's
appreciate what you're
okay.
doing. Thank you very much.
Okay.
Okay,
Thank you.
ladies and
God
gentlemen,
bless.
we now have to shift to, I don't know if it's in Malacanang. The president is about to give his speech. Thank you very much.